Hello, everyone. Welcome back to Hustle and Glow. I'm Dr. Kim Nichols, board certified dermatologist and owner of Nichols MD of Greenwich, Skin Lab in Harbor Point, Stanford, and my brand new location, Nichols MD of Fairfield. Thank you for joining us today. As you know, I created Hustle and Glow to educate those in the beauty business on how to attract, maintain, and grow loyal clientele. Each topic is curated by me for you with passion and profitability in mind. We all know that your staff is an essential part of maintaining and growing your business. So I have invited members of the Nichols MD team to share their own pearls from their respective roles in the aesthetic industry. I hope this series gives you not only an insight on different aspects of what makes a business work well, but also provides a glimpse into the hard work, passion, and dedication of my staff. On today's episode, I'm thrilled to introduce you to our lead master esthetician and educator, Jessica Berquist-Romanzi. Jessica will be educating you on the importance of safety and efficacy in chemical peels. Enjoy!
Hi, everyone. Welcome to another episode of Hustle and Glow at the Nichols MD Institute. As mentioned, my name is Jessica Berquist, and I am Nichols MD's Master Esthetician and Chemical Peel Specialist. And today's episode will be about safe chemical peeling for all skin types and how to create the best treatment plan for your patients. About chemical peels. So what is a chemical peel? A chemical peel is a technique utilizing different acids to stimulate skin cell turnover for skin rejuvenation. And what do they treat? Chemical peels can treat a wide range of skin conditions, such as dull, uneven skin tone, sun damage, melasma, hyperpigmentation, acne scarring, uneven texture, large pores, and even rosacea. Who is a candidate for chemical peels? Really, any patient with the above conditions is a candidate. People who shouldn't be treated are those who have large open wounds on the skin, extremely sensitive skin, or skin that is in a sensitized state due to a health condition or medication that they may be on, patients who have recently sunburned skin, peeling skin, patients also undergoing a chemotherapy treatment for cancer or any other treatment for cancer, and patients who are prone to cold sores and maybe just having a flare-up. And how do chemical peels work? Chemical peels act as an exfoliation method to increase the rate of skin cell turnover. In a sense, they loosen the glue that holds our skin cells together, allowing the dead skin cells to exfoliate off the surface, and it reveals the fresh new skin underneath. So there are many different acids in chemical peels, and the two most common kind of families of acids are alpha hydroxy acids versus beta hydroxy acids. So the difference between these two are that alpha hydroxy acids, AHAs, are water-soluble acids that help to peel away the surface layer of the skin. The BHAs, which are the beta hydroxy acids, are oil soluble and can get deeper into the pores and remove the dead skin cells and the excess sebum. So we're just going to go through our most popular alpha hydroxy acids and most popular beta hydroxy acids that are used in chemical peels. So we have glycolic acid, which most of you may have heard of before. This is an alpha hydroxy acid. It is used to dissolve dead skin cells and to encourage them to slough off. It's commonly used for brightening, treating discoloration, smoothing texture, and refining pores. This is probably one of the most common acids that we use in chemical peels in the industry. Then we have lactic acid, which is also an AHA. It's ideal for skin brightening as well as treating pigmentation, dry skin, and rosacea. It has larger molecules to penetrate the skin slower and therefore is a little gentler on the skin and does not penetrate as deep. So this peel, this type of acid is great for somebody who's just starting with chemical peels, maybe somebody who has a darker skin type, somebody that you need to really treat more cautiously. Similar to lactic acid, we have mandelic acid. This is also an AHA. It's also an acid that has a larger molecule, so it takes more time for it to penetrate the skin, which means it can be a little bit safer for certain skin types and skin conditions. It's effective in treating superficial redness and uneven skin tone. It's also good for oily and acne prone skin. We also have citric acid. It's also an AHA. It's normally blended with another acid. The reason being is because this isn't really as much an exfoliating acid as it is a brightening acid. So you need to blend it with something else to make it exfoliating. And that way the acid can penetrate and really get down into brightening the skin. It's derived from oranges and lemons, just like the name of it kind of says with citric. And it's a very brightening acid, as I said. We have salicylic acid, that is our beta hydroxy acid. It's a very oil loving acid. So it really draws to the sebum in the skin to help purify and exfoliate. So it's especially beneficial for oily prone skin and acne prone skin with enlarged pores. It has anti-inflammatory properties and can help to lighten discoloration and post-inflammatory hyperpigmentation. Then we have trichloroacetic acid. This just stands for TCA. A lot of people have probably heard of TCA peels in the industry. These usually come in the form of a deeper peel to treat wrinkles, texture, hyperpigmentation, laxity, and scarring. So when we talk about chemical peels, we have different strengths and different depths to each acid. So we have light chemical peels that penetrate the most outer layer of the skin, the epidermis or the stratocortium, to give skin a very healthy glow and no visible peeling. We normally refer to these as red carpet peels, as they can be done the day before an event, just to give your skin a nice overall look. Then we have a medium strength chemical peel portfolio, which helps to penetrate the top layers of the skin and treat the skin concerns that lighter peels cannot. So it's just penetrating a little bit deeper into the skin. And there is minimal to no visible peeling depending on the acid, depending on the skin type, and a series of 3 to 6 are needed for optimal results. Then we have deep superficial chemical peels. These are much deeper than a medium strength peel, as they will cause a little bit of sloughing of the skin. There may be a social downtime of about 5 to 7 days or so as your skin's kind of going through that shedding and exfoliation process. These penetrate the skin just to right above the dermal layer of the skin, and they just help to treat the deeper skin concerns. A series of 3 to 4 are typically needed for these type of peels for optimal results, depending on what you're treating. And then there are some deep chemical peels. These are really the deepest in the industry. So they penetrate to just above, actually, they do penetrate the dermal layer of skin, and peeling and crusting can be expected for at least 2 weeks post-treatment. So as providers, we need to evaluate our patients and create the appropriate treatment plan. So you want to consult with your patient to find out the following. What are their skin concerns? Why are they here? What are their concerns in terms of what they want to treat? What products are they currently using right now? What's their Fitzpatrick skin type? Are they a 1, are they a 2, or are they even a 6? To find out the true Fitzpatrick skin type, you really have to dive a little bit deeper and ask how their skin responds to sun exposure. Looking at me, you could assume that I was a Fitzpatrick too, but if I told you that when I went out in the sun, hypothetically without sunscreen, my skin automatically tanned and never burned, that would automatically put me at a Fitzpatrick 3 or higher. So you really just can't look on the surface. You have to have the conversations with patients to know how their skin responds to the sun. You also want to find out, is this their first chemical peel? Have they ever done a chemical peel treatment before? And if they have, what was their response? Did they know which acids were used on them? How many have they had? You also need to find out, what's their lifestyle? Are they outside playing tennis in the sun all day? Are they flying on planes for work a lot? Are they traveling? Do they have any underlying conditions? Do they have allergies to anything? And you also want to just look and see what you can see that can be improved. It's always important to go off of what the patient's concerns are, but it's also important to know what you think can be improved in their skin. It might not be something you need to address right away because it's not their main concern and you really want to treat their main concern, but treating both their concerns and then what you see on their skin that could be improved is really probably going to make them a happier patient in the end, because they're going to see an overall improvement in many different skin conditions. Considering all the above, you as the provider need to then create a safe treatment plan for your patient. You need to choose which peel to start with and at what rate, if any, will increase to the strength of the treatment. Everybody is different. If somebody comes in and starts with a medium strength peel and their friend comes in a week later and wants the same thing, that's just not how it's going to work. You really need to assess and go through all of these questions with your patients to find out what going to be right for them and really tailor a unique experience for them to give them optimal results. So let's talk about prep and why it's so important. So the chemical peel itself is important, but prepping the skin is actually the most important step to these treatments. One of the most important steps as a provider to ensure your patient is to ensure your patient is prepping their skin with the appropriate skincare regimen. If a patient comes in and is interested in doing a chemical peel, or that's something that I'm going to recommend for that patient, I need to know exactly what they're using on their skin so I can feel comfortable treating them. Here at Nichols MD, we always recommend that we get patients on a skincare regimen for at least 2 weeks prior to at least a medium strength peel. Lighter peels are something that won't really interfere with certain things that patients may be using, but if you're starting them off with a medium strength peel and up, you want to make sure they're prepping their skin the correct way and that you know exactly what they're using. So we recommend for at least 2 weeks prior, we get them on a gentle cleanser, nothing that's going to be exfoliating for their skin, an antioxidant serum, because this is going to just only help strengthen the skin cells, brighten their skin overall, and really get their skin ready for that deeper treatment. A broad spectrum daily SPF is super important. And I think a lot of people in the industry know that post peel, it's something that's non negotiable. I also say it's non negotiable pre treatment. If a patient is not using any sunscreen at all, no matter what their skin type, the melanocytes in their skin are activated. And if they come in for that chemical peel, the peel can actually pull up some of that melanin and cause discoloration. So they really need to be preventing that from happening by using a broad spectrum daily SPF before they're treated with the chemical peel. It's ideal to also get them on a serum or cream to help prevent discoloration. There's a lot of serums on the market that help lighten hyperpigmentation, prevent discoloration from forming. So just to be able to kind of suppress that before any strong treatments is ideal. They should be using a moisturizer just to keep their skin hydrated and nourished. And then, of course, 2 weeks post peel, they need to be off any retinols, alpha hydroxy acids, or beta hydroxy acid products, harsh scrubs, facial waxing, none of that for about 14 days prior to the chemical peels. So, really, nothing exfoliating because the chemical peel can then penetrate a little bit too deep, and we don't want any adverse events happening. Putting your patients on a skincare regimen will then ensure the safety of the procedure because you know exactly what they're using and that won't interfere with the treatment plan. Patients who agree to prep their skin pre-peel will also agree to use the correct products post-peel. So you already have that knowing that they're going to be compliant with you post-peel as they are pre-peel. Using the appropriate skincare will help enhance and give them optimal results for their treatments, and that's what we're really trying to do. Patient compliance and trust. Along with your chemical peel prep regimen, patients need to comply to your customized treatment plan. Patients who cannot come back within the treatment time period, for example, if you tell them every 2 weeks or every 3 or 4 weeks, and they can't really commit to that, they just won't see the optimal results. And each time they come in and that gap gets longer, they may actually be starting back from scratch. You want to go over realistic expectations with your patients. Explain that it's a marathon, it's not a race. Slow and steady always wins. You really need to get to know their skin as they're getting to know you as their provider. And this forms a trust relationship between the two of you. Visible peeling versus microscopic. For patients who are doing light to medium strength peels, they're not really always going to see peeling at all, if any. So you need to set the expectation that just because they're not seeing a visible peeling doesn't mean that they're not getting the results that they're looking for. Microscopic peeling occurs in every peel, and it just so happens that patients might have to do more of the lighter to medium strength peels to see the optimal results. I always say it's like a side effect from a medication. Some patients may feel drowsy after taking the medication, while others don't at all. So everybody's different and everybody's skin is different, and the way they respond to things are different. Darker skin types need to be treated gentler than lighter skin types. So because of their melanin production, a lot of patients who have darker skin types need to be eased into certain chemical peels. Whenever I have somebody come in who wants to start with our strongest acid peel, no matter their skin type, I always explain to them that I need to get to know their skin and that they need to really earn that stronger peel. So especially if they're a darker skin type, we're going to start with a lower acid like a lactic or a mandelic, make sure their skin tolerates that well with that larger molecule. And then eventually we can build them up to glycolic, salicylic, and even TCA. And this is why it's so important to have a wide chemical peel portfolio at your practice so each patient can benefit. If you really only carry about 2 to 3 chemical peels, there's going to be somebody out there that's just not going to benefit from one of those peels. And you want to be able to offer any, treatment to any patient. So this, as I said before, creates a trust. Really being cautious and honest with your patients and setting the expectation creates a trust with your customers and will create them to trust and return to you. You may offer many different services such as microneedling and different lasers, but more patients are peel patients than laser patients. Reason being, a lot of patients that we treat for peels are prone to hyperpigmentation or have melasma, which is a hormonal hyperpigmentation. A lot of these patients actually can't be treated with lasers because there's a light and heat to some certain lasers that can overstimulate melanin. So peels would be the way to go for certain patients. And peels are affordable and effective. They're extremely effective, and typically, depending on the peel, it can be less expensive than a laser for some patients. Credentialing during the appointment. So I actually love this slide. I took this from another Hustle and Glow episode because I totally agree with it. And when your patient is coming in and doing a series of chemical peels, you always want to review their photos, however you have them set up. We personally have them on our iPad, so you can sit with the patient, go through their before and after photos, and track their progress. You also want to review real before and after photos from the practice of hopefully all different skin types that you've treated. You want to use marketing that reflects you and the demographic of the patient. And for speaking points, you want to explain how often you perform the treatment. A patient's going to feel much more comfortable seeing you for any treatment, whether it be chemical peels or any cosmetic service, knowing that you really have your hands on that treatment and are doing it often on many different skin types. So if that's true, you really want to speak to that. And you also want to discuss your reasons for loving the treatment. Personally, I've done chemical peels on myself for years now, and I always speak to my patients, telling them about my experience with the chemical peels, the different strengths I've used, and how much I love the results on all of my patients and myself. So just to briefly go over our portfolio of chemical peels, we have our gel peel, which is a no downtime glow up peel consisting of 20% glycolic acid and 10% lactic. We have our microsensitive peel, which is a hydrating and brightening peel. It's a 2% lactic and niacinamide with phenol. We have our glycolic peel, which is basically what it says. It's a straight up glycolic 30% acid peel. And we have our pore refining peel, even skin tone and texture, and it's a 20% salicylic acid. We have a pigment balancing peel, which evens tone and texture. It has glycolic acid, vitamin C, citric acid, and emblica. We have our advanced corrective peel, which is a youthful refresh for skin rejuvenation, and it contains salicylic acid, lactic, and phenethylresorcinol. And then we have our strongest, which is our trichloroacetic acid. It's our smart TCA peel, including trichloroacetic acid. So it's nice to hand this card to patients so that they know that we have a wide range of chemical peels to treat their skin with, and they can know that even if they're starting with the microsensitive peel, they might not be stuck on that peel through their whole series. We might eventually really get them up to that smart TCA peel. So these are some before and afters that we worked very hard on with these patients in terms of just overall helping with their concerns and their complexion. And as you can see, we have a few different skin types in here. So on the left, we have a before and after. This was after a series of 3 deep superficial chemical peels, our TCA peel. So this patient was on a regimen with us, a SkinCeuticals regimen, actually for years before we started her on chemical peels. And we started her on a medium strength peel and built her up to eventually the TCA series. And as you can see, her overall complexion has significantly evened. Her skin overall is brighter, more glowy. She was very happy with her results. On the right, we have more of a skin type 2, and this person was struggling with a little bit of sun damage and a little bit of acne scarring. And for this patient, we started her off as well with a medium strength peel, our pigment balancing peel, and built her up gradually to eventually getting to our trichloroacetic acid peel, where she did see some visible peeling, which really helped to peel off some of that sun damage on that upper corner of her cheek, and then also help with the scarring. So on the right forest photo, you can really see her complexion. Again, it's just more even toned, brighter, and even the pores look a little more refined. Then we have a medium strength chemical peel series. So these two patients were patients who didn't really want to see that visible peeling. If they did see any, they preferred it to be more mild. So just to kind of take that risk out of it, we really just stayed in the medium strength range. The patient on the left was struggling with acne, and we did a medium strength peel of our salicylic pore refining peel. She did a series of 3, alternating them with pore cleansing facials, and her results were phenomenal. She's very happy, just less lesions on her face, less bumps. The pictures actually don't even do it justice. In person, it's even better than it seems. She was extremely happy. And then on the right, we have a series of our pigment balancing peels. So this patient was a skin type 4, if not teetering to a 5, and she was a bit nervous about seeing any visible peeling with her skin. We did a series of 4 pigment balancing peels, and as you could see, the pigment on her cheeks significantly lightened. And that concludes this episode of Hustle and Glow on chemical peels and the safety of treating your patients. I thank you all so much for attending. And if you have any other episodes you'd be interested in viewing, please go to our website at www.kimnicholsmd.com and submit the form of which types of topics you would like covered. Thank you so much.